This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So this is a medical minute about a topic about the idea of people who are intubated and ventilated in the emergency department and are paralyzed either right after their intubation or potentially continuing paralysis, and aware while paralyzed, or awareness with paralysis. It's obviously something that nobody would want for us or for our patients. And it's something that's been looked at in the operating room because, that's where most people are intubated, and it's pretty low, but it does happen. And then over the last couple of years, there's been some studies looking at it more in the emergency department. And there was a study last year that showed that it was much higher rates than in the operating room. That shows about a 2.5% risk or chance of being aware while being paralyzed. And in the study from last year, it showed that it was much higher chance of that happening if you've got rocuronium, which makes sense because it's a longer acting paralytic, and maybe they're not getting sedation as well. So there was a follow-up study that just came out this past month that looked at 3 different emergency departments and kind of tracked the rate of this, and it actually showed it was even higher. It was about 3.5% of patients were aware while paralyzed, and again, it was much higher in patients who'd gotten rocuronium. It was about 5.5% of patients who got rocuronium had this happen, whereas if you didn't get rocuronium, it was less than 1%, like 0.5% chance. So, I think it's something for us to be aware of. This is obviously just not something anybody wants, like I said, but it can lead to significant PTSD. The idea of longer-term depression, even suicidal thoughts can happen to patients who have this happen. And, we should be very careful of it, particularly in patients where we use rocuronium for their initial intubation, or if they get repeated doses of paralytics, being very, very proactive to give these patients sedatives, pain medicines, making sure that they are sedated, because when they're on longer-acting paralytics, they're not going to give us any signs that they're awake. They're not going to be trying to grab things. They're just going to be paralyzed and potentially aware. So any questions or comments? All right, thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.